I once had an interesting conversation at a social event with a doctor who told me about a patient that had come in recently, and the patient had two questions. The first question is the way the patient put it is if they did the right to die thing, as in would they, do the doctor-assisted suicide, and how much would it cost? Now, the doctor I was speaking to, he told the patient, there's nothing wrong with you that I could not fix in 2 hours. And the patient was adamant. He's like, okay, well, but if that doesn't work, can we still do the right to die? And the they're saying, fine. If it doesn't work, then fine, we'll talk about that. Now, imagine this. Think about where that person had gotten to, right? The way that I told the story, I mean, it seemed kind of it was told in a way that was kind of comical, but think about where this person was. They had a problem that was putting them in a lot of pain. Like they were in a lot of physical pain to the point where they just wanted to end it. And there was nothing wrong with them that couldn't be fixed in a couple hours. And as absurd as that story may seem, or as tragic as that story may seem, it is not very different from something that we see a lot in education. One of the most common requests that I get in education and tutoring is there a way that you can teach the student how to do this thing without worrying about if they actually understand the concepts or anything like that, and just somehow so they can pass the quiz or the test by tomorrow or finish the paper by tomorrow or whatever? And the answer is yes. The answer is yes. I could do that, just like this doctor could, has the medical knowledge to kill somebody if that's what was necessary. When somebody's asking you for that, when whether a parent or student is asking for that, what it means is they've said it's hopeless for this person to learn how to do either algebra or writing or whatever. And the reason that they think that is because they've tried and they've gone to so many places and it's been such a struggle and so painful that they just wanted to stop. They just want to just get it done, forget the learning. They long since gave up on the learning, and right now they're just in the can we minimize the pain of this misery mode. They're no longer saying, can I learn math? They're no longer asking the way they might have a few years ago, can I become a better reader? They're saying, can I just not have this pain last right now? The simple fact is this. Most of the students that we see that come in that situation, it's something that can be fixed in maybe 2 hours of tutoring, maybe 10 hours of tutoring, maybe 15 hours of tutoring. I mean, think about this person who went to the doctor asking not to be cured. He didn't ask to be cured. He asked to be killed for something that was curable. Now, let's say it wasn't something to be cured in 2 hours. What if it would have taken 3 hours? What if 10 hours, 15 hours, even 20 hours? Would it really be worth killing yourself over something that can be fixed in 20 hours? I mean, I don't think most of us say it's most of us would say like, no, just do the 20 hours of whatever medical care or surgery or whatever it takes. And the same is true in education. What if you have some long-standing issue with math that's become this horrible, painful, unpleasant thing, and you've just given up? You're just like, I can never be. What if you could be good at math? Would that be worth 2 hours? Would it be worth 10 hours? 20 hours? I mean, there's what I mean, I don't think there's anybody who would say, well, oh, it's going to take 2 hours. I don't want to spend 2 hours. That's insane, right? Most of the things that you're dealing with, and I get a lot of you guys are right now dealing with stuff that it seems impossible. It seems hopeless. And partially it's, that's kind of maybe the type of education you've seen so far has just not been as advanced as the techniques that we use right now. That patient, if he'd gone to a doctor in the 1700s, there's a good chance that that doctor in the 1700s couldn't have done anything to help him. But he didn't go in the 1700s. He went in the 21st century, so he had other options. And those of you guys who are coming to us, we are using techniques. Our techniques that we're using are more advanced. They're more precise. We can do more things than people could 50 years ago, or that honestly than other people can do right now. So before you throw in the towel, before you come in and say, can you just get me past this? I don't care if I learn this ever. I just want to just somehow survive school and then not learn anything. Before you kill your own education, before you just give up, let's actually talk that over. Let's look at the situation. Let's see, is this actually as unfixable as you think it is? It probably isn't. It's probably something that we can fix in a few days. A few days, and that misery that you've been dealing with in math or reading or chemistry or physics, whatever it is, it's something we can fix in a few days. You don't have to either live in misery or just try to get somebody else to do your homework for you. We can actually help you get good at that. It's so important that you don't give up before you actually start. We can almost certainly help you actually master whatever topic it is that's making you miserable right now.